Hi, this is Dr. Priya here, consultant laparoscopic gynae surgeon, Altius Hospital. Now, today we are going to speak about white discharge per vagina, which is a very common complaint. Almost two-thirds of the women population will be having this symptom. Now, when are you supposed to worry about a white discharge? White discharge can be normally seen in some of the situations like nearing your ovulation, prior to your menstruation or after menstruation, and during sexual intercourse. These are all the situations where white discharge, which is thin and some mucoidy, is considered normal. Now, when are you supposed to worry about the white discharge? Now, whenever the white discharge is in an altered color, a thick, curdy white discharge, greenish color, or it's very frothy, or there is an associated itching and foul smelling vaginal discharge, and if you have fever or any abdominal pain situation along with this. Now, what do you do when you find an abnormal vaginal discharge? So whenever you have this abnormal vaginal discharge, you have to contact a gynecologist, where a gynecologist is going to do a clinical examination and see what kind of vaginal discharge it is, and if it's abnormal, they are going to take a culture from the swab from the white discharge, and some of the abnormal white discharges can be treated just by the clinical examination, which does not even require a swab. And then an associated ultrasound also needs to be done when the abnormal white discharge falls into the category of what we call pelvic inflammatory disease. Now, how do they get infections? Most commonly, it can be an abnormal hygiene, and then it can be a sexually transmitted through your partner and by the way you use your washrooms. When are you supposed to have to worry when there are abnormal white discharge? One is the pathological white discharge, which I already told you, a thick curdy white, which is the most common. Again, it leads to what we commonly call as candidiasis. That is due to a common Candida albicans fungus infection, which can be usually treated with the local vaginal pessaries and the oral antifungal medications. Now, the other thing which we commonly find is the cervical erosion. So, for cervical erosion, the patients will be going on and off and for many years with the white discharge. For these sort of patients, there is something called as cauterization. Either it's a thermal cautery, where we do with the cautery machine, which is available in the operation theatre, or the cryo gun. So both of these procedures can be done, but they have to be done in the operation theatre. And what seems more better is the cryo gun, where that part of the cervical erosion part is burned with the liquid nitrogen at a subnormal temperature. So what happens is, after the procedure, either with the thermal cauterization or the cryo gun, you are going to normally expect the 3 to 6 months of watery discharge, which is quite expected to be normal. So, and what are the extreme cases where you're supposed to again worry about the white discharge? Let's say an extreme ages, where elderly people who have crossed 40 or 50, where continuous foul smelling, just watery discharge or a blood stained discharge could indicate a cervical cancer or an uterine cancer also, which seems very dangerous signs, and you have to contact the gynecologist. So for any more contact details, you can log into our website or contact us on the number given. Thank you.